It's week number 38 of the coronavirus pandemic here in Los Angeles. December has finally arrived. Christmas is on the horizon, and the winter temperatures are hitting hard here in Los Angeles. On Tuesday, the CDC made a special announcement. It went like this. The CDC is providing public health agencies with options to shorten the length of quarantine in some situations. Under these options, your local health department may decide quarantine can end, number one, after 10 days without a COVID-19 test, and if the person has reported no symptoms during that 10-day period. Number two, after 7 days with a negative test result, and if the person has reported no symptoms during that 7-day period. The best way to protect yourself and others is to stay home for 14 days. If you think you have been exposed to someone who has COVID-19. Check your local health department's website for information about options in your area to possibly shorten this quarantine period. So in a sense, it's just saying that the quarantine period can actually shorten from the recommended at first 14 days to 10 days. This is the CDC's recommendation. However, every city has their own way of doing things. For example, here in Los Angeles, for people who travel in or from the state, or if they have been exposed with someone that had COVID-19, it's going to be 14 days. It's not going to shorten anytime soon, regardless if you take a test. So maybe in a different city in the United States, that could change. But again, that's what the CDC does. And it's all up to that city's public health department and what they decide what's best to go forward. So something interesting to think about of how CDC is approaching this going forward, especially during these winter months where COVID-19 cases are skyrocketing at this very moment. On Wednesday, the Los Angeles Mayor, Eric Garcetti, urged all residents living in Los Angeles to please remain in their homes while the safer-at-home order is in effect. The reason why is because of the surge of COVID-19 cases that is overwhelming the city, as well as a trend that a lot of hospitalizations are increasing in all the hospitals in Los Angeles. And it's almost looking like that Los Angeles is being one of the hot spots of COVID-19 in the state of California as well. Speaking of the state of California, the COVID-19 situation isn't looking so good. The reason why is because on Thursday, Governor Newsom made changes to the statewide stay-at-home order. Now it is a regional stay-at-home order. This was an emergency response because of the surge of COVID-19 cases and hospitalizations that was going throughout the entire state of California. So what is a regional stay-at-home order? Well, we're going to dive into that. So first things first. California regional stay-at-home order goes into effect after a region reaches less than 15% ICU availability, meaning that the ICU capacity in hospitals falls below 15%. When in effect, California must not gather. Certain sectors will close, and sectors still open will require 100% masking and physical distancing. The regions, so the map of California as you see it, are divided into different regions, and 90% of California is in that purple tier, which falls under the stay-at-home order. Why does this help? If we don't act now, California will reach an ICU capacity. In other words, the hospitals will be overcrowded, it will be full. You do not want to be in a situation in which you need medical attention, but no doctor or nurse can help you because the doctors are just overwhelmed because of COVID-19 hospitalizations. The targeted action will result in reduced mixing, which limits the spread, meaning not mixing with other family members, going in other people's houses. With less spread, we will preserve hospital capacity, protect those most at risk, and save lives. To draw back a little bit on the California limited stay-at-home order, which is the regional stay-at-home order, all essential workers are allowed to go out and about because they're working. But for those non-essential people, they should stay home between the hours of 10 p.m. to 5 a.m. It has been on effect since November 21st and will end on December 21st. And this helps stop the spread. If everyone does their part to stop the spread, we can prevent maxing out California hospital systems, like I said, overcrowding of hospitals, ensure healthcare workers can come to work safely, and protect the most vulnerable. So in other words, this stay-at-home order is to save lives. Staying home saves lives. It is simple as that. So I'm going to do my part of doing what I have to do. And what I got to do is to stay home. Staying home is the best option right now, and I'm going to do it to the best of my ability. Yes, it's frustrating. It's a little tough just being home all the time, but these are very unique times. And in order for me to make sure that I don't get sick or other people don't get sick, it's just a simple thing to do, staying home. And again, staying home is the best thing that we can do at this very moment for the state of California. Regarding the coronavirus here in Los Angeles, the number of cases and hospitalizations are still surging, still increasing. They have not decreased whatsoever from the past weeks. And this is a very scary trend that the public health department is giving to all Angelenos, and they're urging all Angelenos, anyone who lives in Los Angeles or resides in Los Angeles, to please stay at home and only go out for the essentials or the necessities. The COVID-19 situation here in the United States continues to get worse and worse as the weeks goes by. The United States still is the #1 country in the world that has the most COVID-19 cases and the most COVID-19 related deaths. The Johns Hopkins University actually has made this chart that shows how COVID-19 cases has accelerated over time in the United States of the beginning of the pandemic earlier this year in March. As you can see in this map, it shows how dramatically COVID-19 cases has risen in the last couple of months and weeks. And it could be for a number of reasons, because of failed policies, because the state or city opened way too soon, and also because of the fall and winter months that is also adding fire to more contamination and spread of the virus. So the CDC and other public health agencies are urging all Americans to please do their part to wear a mask at all times, anytime they do go outside, to social distance, to wash their hands, and to make sure to sanitize their area all the time. If they can follow these simple steps, then we might have a fighting chance. And that also, just because the vaccine is on its way, it doesn't mean that we can be complicit. We still have to be very vigilant. We don't know how long the vaccines is going to take to be effective, to be available at the market, and also the time frame of when people are allowed to take this vaccine. So again, we all have to do our part. I have to do my part as well. I have to stay vigilant as possible, especially now during these very cold fall and winter days. Lastly, I do not want to end in a negative and sad note. There's actually some good news. Great Britain becomes the first Western nation to approve the Pfizer COVID-19 vaccine for distribution for the entire country. So starting next week, it will be available for emergency use. That is good news, meaning that Great Britain will become the first nation to actually experiment with a COVID-19 vaccine, and hopefully we get some positive feedback that this vaccine does work and helps stop the spread of COVID-19. God willing. The United States has yet to approve any vaccine yet, but until then, I will continue to wear my mask, wash my hands, disinfect, and social distance. Until they have an approval of any vaccine, we still have to be vigilant. We can't be complacent, especially during flu season, during these winter months. So we have to keep on fighting and enduring. And hopefully, if we do get positive feedback from this vaccine, that means we're one step closer in ending this pandemic nightmare. So everyone, stay strong, stay safe.